Yeah, it's wonderful to be back. Thanks so much for the invitation. I think today, what I want to try to do in the next hour, about 55 minutes, I want to do a bit of a review of what I covered in when I was out with you all in person a couple of weeks ago, and again kind of reinforce that direct link between the historical production of social inequality and social determinants of health, what the folks from IPS refer to as upstream causes. And then I want to have time to talk in a little bit more detail, take your questions, because I do know that we were up against a clock last time around, and I had the sense that there were some kind of questions out there that we weren't able to get to. And then I want to, we'll get into kind of a breakout sessions within Zoom to do some kind of brainstorming to think through how the material and this research, the data that's presented, all this information, how is this directly relevant to your different agencies' missions and purposes and work. And then third, we'll come back into the large group and do a kind of a quick report out and debrief, looking ahead to next week as well. So just as a reminder, the talk that I gave a couple of weeks ago out there with y'all on the West Coast kind of focused on three primary questions. And these are the questions that animate my own research. Question one, kind of how are our contemporary landscapes of racial inequality produced? Where'd they come from? And then question two is, what are the ongoing socioeconomic, environmental, and health impacts in the present day? And I concluded thinking through kind of, well, where do we go from here? And I think that's for folks in your world, kind of on the ground, working professionally in this realm, that third question is probably the most important. So I want to continue to focus on that today. But I do want to, let me just give a quick recap of where we were last week. So to kind of a quick answer to each of these three questions. First of all, we talked about how the landscapes of social inequality and racial inequality in this country were actively and intentionally produced through public policy. I talked about redlining, and we kind of explored the redlining map of San Diego and some of the ways that during the Great Depression, predominantly white neighborhoods were intentionally invested in order to help homeowners in those neighborhoods avoid foreclosure and to kind of save their net worth and their wealth through home ownership, while non-white neighborhoods were not afforded that same kind of protection. We talked about public housing policy and how public housing policy in the post-World War II era was really mostly segregated, non-white, Black, Latino, Asian, and built in kind of the inner city core areas and formerly redlined neighborhoods, essentially to solve the housing crisis of that period of the baby boom years. To solve that problem for non-white communities was the answer was public housing in dense urban cores. And to solve the housing crisis for white families, on the other hand, was the build out of the American kind of white middle class suburb. And these suburbs were kept whites only through the widespread use of racially restrictive covenants that are still in the deeds of properties today, that basically say anyone who buys, rents, leases, or is even willed and receives through inheritance this property cannot be anything other than white. And so we saw the combination of these federal policies along with, and I didn't talk in too much detail about these other practices, especially of private interests, exclusionary zoning practices of municipalities and cities, discriminatory lending practices of banks. And the way discriminatory lending practices really have a pretty significant impact is by giving higher interest kind of subprime mortgages to non-white borrowers. And what that does is it makes this cost of the mortgage higher, and it pushes non-white borrowers into lower, less expensive homes. And thus it kind of has the 1-2 punch effect of keeping non-white borrowers kind of pushed into not predominantly non-white neighborhoods, and also preventing wealth accumulation through housing, through charging more for the financial product. And so the borrower gets less house and thus less equity in the transaction. Also, we talked a little bit less about the practice of racial steering, of realtors, and then of kind of highway construction and the role of infrastructure. And all of these things together, public policy at the federal and city municipality level, and also the practices of industries, of companies, of zoning boards, all of these things together kind of constituted the long-term disinvestment in Black and brown communities all over the United States. And one data point that I think is always been impactful for me is that even though we passed the Fair Housing Act in 1968 and technically removed these overtly racist and discriminatory laws from the books, even though we did that, the impact of the structure that we built, the housing structure that we built, reverberates into the present day, especially through this massive 90% racial wealth gap, where the median white family wealth in the US is 10 times higher than median Black family wealth. And that's the financial impact of policy, federal policies and institutional practices throughout much of the 20th century, investing in white neighborhoods through homeownership and disinvesting in non-white neighborhoods. What this looks like on a map then, and I'll just run through these maps that I showed you last time, just a couple of them, not as many as last time, but just to kind of get us thinking. What this looks like is that neighborhoods that were redlined in the 1930s are today predominantly Hispanic and Latino in San Diego. They have poverty rates that are twice as high as neighborhoods that escaped redlining. They have home values that are significantly lower. And we talked about how it gets into kind of environmental costs. They have more pavement, fewer trees, and as a result, redline neighborhoods in San Diego are actually physically hotter on summer afternoons. And I thought it was quite appropriate that the one day that I was visiting Southern California last week, or 2 weeks ago, the temperature reached almost 90 degrees Fahrenheit, kind of to make the point that heat can be, and in fact, heat is a really deadly natural hazard in the US. We also, and I'm gonna get there with the liquor stores in just a second. I saw that in the chat. I also showed this map kind of zooming out to kind of try to capture more of San Diego County, this map of social vulnerability. So on this map, the most socially vulnerable neighborhoods are in red. These are neighborhoods with higher poverty rates, lower incomes, lower levels of education, more likely to not speak English in the home, more likely to not have private automobile, more likely to be in kind of less adequate, more marginal housing. So there's this index of all of these dimensions of vulnerability. And you can see a pattern emerge when you look at the social vulnerability across the county. And then the next map here, these are those redlined areas. So we can kind of get a sense of the historical connectivity. And then on top of that, you can put toxic release sites and this big concentration of toxic release sites and surrounding high vulnerability in formerly redlined neighborhoods. You can add in kind of on top of that, the presence of highways and the reduction of air quality, the reduction of mobility, and the reduction of kind of ground quality because of lead contamination in soils immediately surrounding interstate highways, again, concentrated in predominantly non-white, highly vulnerable communities. And then add on to that, this is the data that the folks at IPS have put together on off-sale liquor licenses. And we can see that the majority of off-sale liquor licenses in all of San Diego County are really concentrated in the most vulnerable, the most socially vulnerable neighborhoods. And so I kind of put the map becomes more and more chaotic, and I did this on purpose because we can think of this kind of cumulatively. I think it's important to think of this cumulatively, right? It's not just exposure to lower air quality because of highways. It's not just exposure to lower air and water quality because of the toxic release sites. It's not just the fact that payday lending and check cashing places target high poverty neighborhoods. It's not just the fact that they're over concentration of liquor stores. It's all of those things combined. And to create this kind of what I call these landscapes of inequality, of cumulative risk, health risk, environmental risk, socioeconomic risk, cumulative risk concentrated in the most vulnerable neighborhoods. Whereas you have on the flip side, if I were to map out amenities, if I were to map out community centers and green spaces and parks and all these kind of positive health and positive environmental amenities, the map would be the inverse, right? It would basically flip. And this all reminds me of this data point. I've been doing some work with the Virginia Commonwealth University's medical school and their medical students, that 80 to 90% of modifiable health factors, so we're not talking about genetics here, but 80 to 90% of modifiable health factors are health-related behaviors, socioeconomic factors, and the physical environment, things that are commonly referred to as the social determinants of health. What this means is that healthcare delivery makes up only about 10 to 20% of the kind of the causal factors behind health outcomes. What's driving health outcomes is the socioeconomic, behavioral, and environmental context within which people live. That is to say, what's driving health outcomes is this broad socioeconomic, environmental landscape, a landscape that's profoundly unequal because of the historical processes and then the cumulative impact of all these environmental and social factors. Not to be too redundant about it, but thinking in terms of toxic release highways and liquor stores. And I found this is adapted from a graph that I'm adapting from a nursing textbook that I think really shows this. Then if we think about 80 to 90% of health factors and health outcomes are driven by non-healthcare related, but rather community related social determinants of health, I think that makes it perfectly obvious why I thought the graphic and the animation, the little film that was showed at the presentation a couple of weeks ago before I spoke was so good. And this just as a single still really gets at that we focus a lot in healthcare, and also I'd say in criminal justice, we focus a lot on treating the outcomes, treating symptoms, when the outcomes are actually driven 80 to 90% by the community conditions. Basically, we need to go upstream. There's a really deep need to go upstream. I know there was some law enforcement officials in the room a couple of weeks ago, and I've been doing a lot of work with law enforcement here in the Hampton Roads region. And part of it's driven by my work with criminology faculty members and criminology researchers here at my institution. And we're talking in the context here, and I'll just add this one last quote, that thinking about gun violence specifically, and I know that's off topic for this group, but thinking about gun violence specifically, I've made the point to audiences, including local police chiefs and sheriffs here in the Hampton Roads region, and also police officers, that there are decades of criminological research that shows definitively that concentrated disadvantage leads to higher crime rates, and the same research shows that addressing underlying inequalities reduces crime. And so whether we're thinking about health or crime or kind of environment or housing, all of these different social ills, the impetus in public policy so often seems to focus on treating symptoms, and very little time, energy, and funding flows to looking for those root causes or the upstream causes or the undoing the structural production of social inequality in urban America. And so that's kind of, I wanted to bring it full circle with that, and add on to, if these are the primary research questions that I address in my talk, I want to add this fourth question for us to think about today. What are the connections between this research, data, information, and y'all's own agencies and missions and work in the field. And so with that, let me just pause here. I didn't mean to do that yet. Let me just pause here real quickly and then ask you all because I know we were short on time for Q&A a couple of weeks ago in that community center in Coronado. So let me ask if there's any questions about what I've presented, or if we can kind of start thinking through the connections between this and the work that you all are doing. So let me just pause there and open the floor for questions. Yeah, I see that William has a hand raised.
Thank you. And I just want to say great presentation
Thank
on
you.
April 8th and great information today. You really have opened my eyes to things that I didn't realize
Yeah.
um, how widespread this was back in the 1930s. But I know we're focused on alcohol and this is a binge and underage drinking. And I was trying to catch you afterwards, a lot of things happening. But I
Yeah.
mentioned to Craig about we have legalization for cannabis now, and so much of what you're sharing that we see happen with alcohol, we're on the cusp of doing very similar things with cannabis. So I'm just putting that on the table to maybe have some conversation about cannabis, because what we're seeing is, for some it's being referred to as medicine, and we have recreational use and doctor recommendation for medicinal use in California, but there is a tremendous amount of potential for harm. But it's kind of being brushed aside, and we're actually seeing a lot of people wanting to put the cannabis outlets in the hearts of the communities that are so affected right now from everything else that you put on the map today. So that's what I wanted to put out there, just for maybe a topic of discussion. Thank you.
Yeah, thanks. And I'll just say thank you for that. And thank you for the kind words about the presentation. I will say that the folks from IPS shared with me some data of cannabis dispensaries in San Diego County, and I did map them out. And it was so when you look at like this map of liquor stores here, and when you run some spatial statistics on it, there is a highly statistically significant correlation between the location of liquor store or off-sale liquor licenses and high poverty neighborhoods. And so when you run a regression on that, there's a highly statistically significant correlation. At this point, when you run the same regression on cannabis dispensaries, there's just not enough cannabis dispensaries already licensed and operating in San Diego County to pull out that statistical significance. But that's not because we're not likely to see that pattern emerge in the future. It's just that there isn't yet enough data points to find that statistical significance. But I think you're absolutely right to be very concerned that just like if I don't have the map, and I don't have the map in this slideshow, but in the same way that high vulnerability, high poverty neighborhoods are targeted with payday lending, that overconcentration of payday lending, overconcentration of liquor stores, that an underconcentration of grocery stores, but an overconcentration of convenience stores that have a kind of a tie into food security, for example. I think we can rightfully expect that without intervention, the same phenomena will reproduce itself as well with cannabis. Yeah. So I think you're absolutely right to bring that to the conversation. David, you have your hand up here in the chat or in the screen.
Yes, thank you, Dr. Finn. So in promoting your initial workshop, so just for context sake, I work in the East region, which is more conservative, more pro-business, etc. And so one of the community leaders responded to my post advertising your workshop with a statement, and I'll just read it because I wanted to kind of get your reaction to it. Says, I feel this topic is a shining example of data manipulation for perpetuating and extending bias and racism. Liquor lining, for God's sake, when did the free market become so unequal? What comes first, the liquor store or the customer? I mean, you cannot just open a dozen liquor stores in an area without first having the customer base. The liquor store does not create the customer, and how would that translate as systemic racism or public health equity? then to reach back 60 years to bring in redlining to support this hypothesis. No, David, I don't think this cause will have a positive impact on the community, just the opposite.
Yeah. Oh, sorry, go ahead.
No, I would say, so any thoughts?
Yeah, sure. Lots of thoughts. I always invite, I love hearing different perspectives, even perspectives that I don't agree with. And I love the opportunity to respond to them. And I wish that this person was here and we could kind of engage in a discussion, because there's a lot going on there. But I'm going to go back to my title slide here. And if we want to talk about free markets, or if people want to bring in free markets and say that kind of liquor stores are following markets, I think it's really important to point out that, and I'm not even going to go back 60 years. I'm going to go back almost 90 years. No, this actually, I think, is even more than 100 years old. This line right here, let me highlight it in my title slide. This line right here, that no liquor or ardent spirit shall be made or sold on the property for a period of 15 years from the date hereof. These are very typical restrictions that were attached to property deeds that were placed into the growing white suburbs, starting all the way back into the 1880s and the early streetcar suburbs, and accelerating after World War II. And so it's not that the free market is dictating that these kind of vice industries, if we can use that somewhat problematic term, that these kinds of vice industries are being kind of attracted to particular areas in the free market, but it's quite the opposite. Neighborhoods, municipalities, zoning boards are organizing around kind of preventing them, recognizing that these are socially harmful and preventing them from going into some places, and thus pushing them into other places. And as we know, I mean, thinking about it in the context of, say, for example, an analogous context of a food desert. Grocery stores are one dimension of measuring a food desert. The second variable that has to be in place is a high poverty area. So when you look at an area that has pretty low poverty, the absence of a grocery store doesn't mean that the place becomes a food desert, because the assumption is an area with really low poverty rates, high household incomes, high home values, et cetera, low poverty, those folks have cars, they have the economic means to get out to wherever the Whole Foods or the Trader Joe's or the different grocery stores are. And so the customer base for a liquor store isn't just the population that lives in a 3 mile or 1 mile or 5 block radius. Customers come from all over, as I'm sure that you know. And so what they're doing is essentially, on the one hand, they're pushing vices out of neighborhoods where the community has the wherewithal to keep what they know are problematic industries out of their neighborhoods, but they're still benefiting from being able to go to those places just by hopping in their car and driving down the street to the other neighborhood to take those services. So I'd love to talk more about that, but when we see, if this were a one-off, if it were just liquor stores being concentrated in poor neighborhoods and all other kinds of problematic health and environmental things were kind of equally distributed or were randomly concentrated according to other factors, then I might say, oh, you might have a point. But when we see that it's not just liquor stores, but it's payday lenders, it's interstate highways, it's all kinds of polluting industries, it's always the same problematic things concentrated in high poverty neighborhoods, and all of the opposite, all of these environmental amenities concentrated in the nicest neighborhoods, then I think we have to look for the structures that are creating these patterns. Sorry, that's a long-winded answer, and I know there are other hands
I appreciate it. Thank you, and I'll share this with that individual. I'll share the recording with the individual so he can hear it directly from you. Thanks.
No, thanks. Yeah, all right. Good luck. Thanks. I don't know who was next in the line. Is it Jovita?
Yes, Jovita.
Thank you, I hope I said your name right. Yeah, thanks.
Yes. So I was glad you were bringing up the Trader Joe's and those specialty stores, and we see those going up all in the east side of everywhere. And I always ask the developers when I see them, I see something going up brand new, another Trader Joe's, I go, why is it that you're not putting them in the west side? And their answers are always their study, their research show that we won't go into those stores and purchase anything. And so they're going to lose money. And I'm like, I don't know where they're getting their information, but it's like we travel. I have to go 12, 13 miles to get to a Trader Joe's. Yeah. And we do that. And it's like, how is I don't know where they're getting the research. I don't know who they're asking, but there are so many people in the West that want those stores, that want them, you know, to be in their area. And yeah, in the West, you know, it's over concentrated with alcohol outlets there. You know, it's poor. The city takes very little concern about even fixing streets, potholes, whatever it is. Yeah. And they put more of the money into the East. And so many residents and businesses are constantly saying, going to city council, going to the mayor, why can't you help us? You know, well, but yeah, we will put a light over here, make a bike lane here, make it worse. And but yeah. It's really sad. It's like, where are they getting their research and their data that shows that we're not gonna purchase from a Trader Joe's or a nicer restaurant or a nicer grocery store, because we don't have them.
Yeah, and I think it's not even just the more upscale grocery stores. I think I suspect it's any grocery store at all. And the definition of a food desert, and again, this is not an unproblematic definition, but it's not is high poverty neighborhoods that don't have any grocery stores. So it's not in the East Coast. I don't know if y'all have like the hierarchy of grocery stores, but here it kind of goes from at the very highest end is Whole Foods and Trader Joe's through the Harris Teeters down to Food Lion. And it's not just the absence of Whole Foods, but it's the absence of any grocery store at all. And I think part of that research is problematic in that it's just there's either unconscious or conscious bias in the minds of market researchers about what particular consumers of particular socioeconomic and racial makeups want or will do. I think there's also perceptions of danger, of shoplifting, of theft. And I also think there is a problem that for example, in the context where I am here on the East Coast, the city attracted a grocery store to open up in the center of a really high concentration poverty neighborhood. And it went out of business because putting a grocery store in a high poverty neighborhood doesn't solve poverty. And so there's a whole host of other factors where that grocery store still did go out of business. Now the city has been able to attract another chain, and it's actually operating quite vibrantly for the last 2 years, kind of proving your exact point that folks, even in high poverty neighborhoods, high vulnerability neighborhoods, in fact, do want and need places to get competitively priced, nutritious foods. Yeah, I don't have much to add other than that, but it was a really good point and very well taken. So thank you.
I believe Maxwell's next.
Yeah, thank you.
Yeah, absolutely. Thanks, Dr. Finn. I kind of wanted to ask, one of the things that have stood out to me the most from your presentations have been these like startling quotes from like real land use and zoning laws at the federal and like local level that have such blatant kind of racially and other, you know, kind of demographic factors discriminated against certain groups and things. And I wanted to ask from your perspective, when kind of looking at taking action to address issues of redlining and discriminatory like real estate practices and things like that, obviously we see this kind of language and you think like, how did this language last so long? I want to ask, do you think that there are active attempts by those who are in control of these laws or monitoring these pieces of these regulations to like use the discriminatory language to continue to prevent different demographics from coming into these neighborhoods? Or is it much more that, hey, historically, these have just this has been perpetuated and these practices have now just become kind of commonplace, but the actual, like that language just seems outdated. And so it seems it's more of an oversight of, oh, wow, like we didn't even know that was still in there. that doesn't look very good? Or is it, hey, we didn't know it was in there, but we're still taking advantage of the fact that that language persists? I guess I'm just kind of trying to understand the actual damage that having language like that in these laws at the current times is having.
Yeah, that's a great question, and I'll answer that in two ways, because it's right that this kind of language was found by the Supreme Court to be unconstitutional in the 1950s, and then of course the insertion of this kind of language became overtly illegal with the 1968 Fair Housing Act. But so in a certain sense, like redlining, as is described here, doesn't exist anymore. It is a historical moment in time when this happens, and it doesn't exist. It's no longer happening in a kind of a direct, overt way. But I want to make 2 points to show how the impacts kind of reverberate in the present day. So if you think about this slide, where we have the cumulative effect of all of these different processes of disinvestment. What this means is that all of these processes have resulted in a map where property values, land values, home values in neighborhoods that were redlined due to redlining and all these other cumulative impacts of all these other divestment policies and practices result in a situation where homeowners in these areas, well, one, there's higher renter rates than home ownership rates. But even homeowners in these areas, property values are significantly lower. There's a lot less equity in the houses. And so homeowners have, one, less money to pull through refinancing to keep up their houses. And because they don't have a future promise of increase in equity in the house, they're less incentivized to do so, to keep up to invest a lot of money into their properties, because they're so disinvested that it's not going to increase the value of the property. And so, but what that looks like in our kind of ideology in this country of kind of individualism, right? What this looks like is individuals not taking care of their houses. In those old redlining maps, what they called a lack of pride of home ownership. They don't have pride of home ownership. What they don't have is an economic structure that makes it possible to, and then rewards keeping up one's house. And so, but if you think that communities then, because of this, if your conclusion is that homeowners don't care about their homes, well, then why are cities going to invest in streetlights and sidewalks and filling the potholes? And because the cities then don't invest, it becomes a self-perpetuating cycle where homes don't increase in value nearly as fast. Homeowners don't have the ability or the incentive to keep up homes, and the continuing lack of resources going in to help keep up the neighborhoods at the neighborhood scale. And so it's this kind of downward cycle that continues into the present day. On the flip side, in the other neighborhoods, like for example, I live in a stable neighborhood with housing prices that are increasing. I just a couple of years ago, I refinanced my home to replace all the windows in a 100-year-old home, and I could make a $25,000 investment like that because I feel comfortable. I feel confident that in a couple of years, if I go to sell my house, the house will have risen in value, and I can recoup that investment that I've made. And the neighborhood organizes to get the city to. We have there's the economic and political wherewithal and clout to get the city to keep the streetlights on, to keep sidewalks, et cetera, et cetera. And so you have these like diverging kind of neighborhoods, and it's really the result of long-term disinvestment versus long-term investment, rather than any kind of individual homeowner and their individual hard work versus individual like laziness, right? And so I think we see that happening a lot, and we don't see the structural causes, but we focus on individuals, and we reward individuals for their tenacity or blame them for their own failures, right? The other thing I'll say, so that's kind of how the processes from the past, even though we've stopped officially redlining as government policy, how that set in motion these kind of spirals of investment or disinvestment. On the other hand, if I can go back here, with this question of discriminatory lending, Wells Fargo, just a couple of years ago, settled a class action lawsuit and had to pay hundreds of millions of dollars as a settlement in a class action lawsuit, because during the housing crisis in 2000, in the lead up to the housing crisis in 2007 and 2008, Wells Fargo and also Chase and Bank of America have all settled these massive class action lawsuits because they're giving Black and brown home buyers subprime interest rates. And that's happening in the present day. So it's what's colloquially referred to as modern day redlining, where banks, it's not the government anymore doing it, but it's banks saying that if you want a mortgage in these neighborhoods, or if you're a non-white mortgage borrower, we're going to charge you a significantly higher interest rate, which has the impact of pushing you into a lower home value neighborhood. So even though the government isn't doing redlining anymore, banks and realtors and real estate associations certainly are engaging in systematic discriminatory practices in the present day. Sorry, again, these long-winded answers, folks. Sorry about that.
Oh, thank you so much.
Let me see.
There was one question in the comments that I just wanted to address real quick, which was what kind of policies exist in other cities that don't have high concentration of liquor stores that prevent them from being there in the first place. And I think I can answer this one for you if you at least. In the best cases, there's actually a limit of how many are permitted in a particular area, whether it's by census tract or zip code or some other means. So you'll see that usually outside of California, you'll see that, like, for example, one liquor store cannot open up until another one closes and that license is available. So that in the best cases, there are somewhere in either in the ordinance or even at state level policy or planning and zoning, some sort of cap on how many are permitted in each area. You'll see there's a good example of that in Baltimore, where they are currently over-concentrated in certain neighborhoods, but are now going to be more evenly distributed over time, thanks to some rezoning that's requiring them to move if they are in an over-concentrated area. But that's just a quick synopsis, and I will also say that strong community organizations, community groups actually really do help reducing the number of liquor stores coming into an area. So you'll see that a lot as well. And I know you got 3 more questions. Did you want to continue on with questions, or did you want to try and do the breakout rooms, since we're starting to get close to that time and we need to make a decision on that?
Yeah. I'll since we do have another week, I'll keep my answers brief. How about that? So I don't leave anybody hanging. I'll answer quickly, and then we can move on because I want to hear more from you all as well. So, but I don't know what, I think, was it David? You had your hand up first?
Yeah, David and Jerry.
Sorry, I forgot to put my hand down.
Yes, Professor Finn and everybody. I just want to, I'm looking at the layouts you have there with the maps, and I was wondering if you had looked at government subsidized housing, Section 8 housing, and now what we're talking about in California is affordable housing. Have you done any study and layouts of that in these and see how they align in these areas as well?
Yeah, so that's a great question. I know, and I'm going to stay in my East Coast lane here, because the housing crisis, or crisis of affordable housing here, is, I think, qualitatively and quantitatively different than what you all are facing in California, which is it's a much more acute housing crisis in California than in most of the rest of the country. The extent that we've looked at this, so it's 2 things that I'll say real quickly about that. One is that I worked with some investigative reporters about 1.5 years ago. We used the Freedom of Information Act to get the address records of where Section 8 housing vouchers had been being used during a 3-month period at the end of 2020. And this was in the context of a lawsuit that I was working on against the city of Norfolk about some redevelopment of public housing. And what we were able to show, and I did map out 3 months worth of address records, Section 8 address records, and that just like liquor stores and just like payday lenders, renters using Section 8 rental vouchers, are overconcentrated in the most vulnerable, the most socially vulnerable neighborhoods. So this was in the context of redeveloping some public housing, where about 5,000 public housing tenants were being evicted and were being put into vouchers. And the basis of the lawsuit was basically that public housing, overwhelmingly Black public housing residents, were effectively being resegregated into high poverty, high minority, high vulnerability neighborhoods. So we've seen that for sure. And I can talk a lot more about that, but I don't want to take up all the time. The other thing that I'm just starting to work on with a colleague at a different institution is about the financialization of housing and tracking how financial institutions are buying, especially multi-unit properties, middle and low income multi-unit rental properties, and effectively financializing low affordable and low income rental properties in the city of Norfolk. And this is something that's happening all over the country. So yeah, this is a huge area that needs significantly more research as well.
Thank you. I appreciate it.
Yeah. And I'll put in the chat, just by way of concluding, a link to the article that resulted from the work that I did with these journalists and the FOIA requests that we put in and so on. Is there a question?
Gary, I think it's your turn.
Okay, great. Thank you, Craig. Hi, Dr. Finn. I was doing a lot of work with mapping licenses as well some time ago, but one of the trends that I noticed and that I heard back from the community, especially in Southeast San Diego, which is largely Black population, is that, that when the ABC, the state ABC allows licenses to be too many licenses in areas where they're zoned. So for instance, I lived in Pacific Beach and there's one census tract that has something like 50 licenses and it's only supposed to have 6 or 10. Wow. And in the Southeast area, because the ABC lets people over concentrate in some areas, other communities cannot, they don't enjoy the benefit of an entrepreneur looking for a new market and exploiting that. And they, are then forced to use their own vehicle if they want to go out because the transportation stops at 12:30 and the Ubers are very expensive. But the one thing that really hit me was, they were saying, look, we can't even open up a jazz club and go out and have a little nice time in our own neighborhoods. And it's largely because of this kind of practice. And so it seems like we're perpetuating the problem at the state licensing level. And they're fully aware of the issue and still persisting. So it would be great if we could help alleviate that, but I know it's a long haul. So thank you.
Yeah. Thanks. I don't really have a response to that other than it sounds like an issue that all the folks on this call and everyone else are thinking about a lot. So thank you for that. All right, you want to do one last quick one? Is that William?
Thank you. Yeah, I'll be quick. I just wanted to share 2 points. One, I think, is maybe the city of San Diego is doing something that's going to be helpful. They're currently looking at changing what happens with the development fees on new constructions and things like that, where the current policy has those development fees staying in those neighborhoods and can only be used in those neighborhoods. And what they're proposing is, if this ordinance passes, that any new development, those fees then could be used anywhere in the city of San Diego, because I think the council, there's been a lot of change with the makeup of the council over the past few years. And I think they're recognizing absolutely the underserved communities and an inequality there. So I think that's really great to see that happening. It wouldn't affect any of the fees that are currently held, that, for projects in those neighborhoods. It would just be the new fees. And then listening to you talk, I'm thinking I was probably one of the people that got affected in the financial crisis, maybe a different type of redlining that you're not talking about, where I had a credit card balance. I was making my payments, never missed a payment, no issues at all. And I get a letter from the bank saying, hey, we're raising your interest rate from 13.99% to 29.99%. I'm like, why? Well, just a business that we're doing here. And I'm like, how can you do that? The only choice I had was to pay the 29.9% or close that account and lose all the credit history I had with it and pay it off at that current rate. So I'm guessing and that was a major bank that did that to me. And so I'm guessing that that's another form of this, because the neighborhood I live in is right in the area where you're showing the redlining and stuff going on, and the inequality happening and stuff all here.
Yeah, and I can't speak to that specific experience, but what we have seen, what we've seen, whether it's with home loans or with rental units, with landlords, with banks, like profit driven by, or profit incentives on the back of racial, ethnic, language discrimination. Those two things are oftentimes tightly intertwined, where both conscious and unconscious bias can create incentives for, or not just incentives, but can create actual opportunities for profit. And we see that happening all the time. I mean, that's what racialized or racial discrimination in lending precisely does, is it delivers higher profits to banks on the backs of Black and brown home buyers. And so it wouldn't surprise me if there's to hear that there are other manifestations of this as well. Y'all, so let's do this. My original timeline had us going into breakout rooms and then coming back for a report out. I wonder if we can, for now, go into the breakout rooms and kind of close out the session, thinking through how these the information in the presentations, but also our discussions here today, how they impact your own work and your own agencies and your own projects. And then next week, we can kind of come back and use this as a starting point and to go into significantly more detail and kind of looking for these kind of action steps. And so does that sound good? I know we're up on the clock, but we still do have a few minutes left. Does that sound like a good plan of action, Craig?
Yeah, we can have everybody in. I got the break rooms already ready to go, so we can just make the groups a little smaller, and that way they can get through things faster. So give everybody like 5 minutes in the groups to discuss things. Yeah, and we can put this in the chat. But you can, of course, people can talk about whatever they want. But I've thought through, especially these discussion prompts here in the center. And Craig, you can drop that in the chat, and we'll drop in the chat into the breakout rooms as well. But really thinking about this central question here that I'm highlighting. What's most relevant in all of this to your work and your agency's mission? Because I think that's going to be what can guide us in developing kind of ways to operationalize some of this. And that's where we'll go in the future. So let's have this as the center, and Craig or I can drop these into the chat once we're in breakout rooms, because I don't know if the chat goes with us into the breakout rooms. But with that, I'll turn it over to you, Craig. Okay, sounds good. And just so you know, Dr. Finn, you'll probably end up in a group the way this is all set up. So somebody gets some extra time with you on like 2 or 3 people. So we'll go ahead and get started, and we'll be back in about 5 minutes. I was just going to ask if anybody had any key takeaways from the discussion that they wanted to mention real quick.
Community disinvestment is very dangerous, and we now understand why communities look the way they do, and it's not individual choice, it's structural systems that are put in place. I thought that was a really big standout.
I'm so thrilled to hear that. And a lot of the kind of what we see that I see is the ideologies of individuality really kind of prevent us from seeing the structure. So right on, thanks. I'm so happy to hear that.
David and then Bill.
Yeah, there was a gentleman earlier who talked about a response he got from an email about this session, and talking about the free marketplace and those sort of things. And I can't help but think, and we were in a breakout room for a little bit, started to talk about it. I was in there with Pedro, and he's in the Indian communities here in San Diego County. And to me, I'm learning more about this stuff as I go, as I'm relatively new to this, but I can't help but thinking some of the neighborhoods who don't have a lot of the liquor stores establishments are there because for a couple of reasons. One is I think that people are outspoken about it, and they work to limit the location of those places. And 2, why are they in other neighborhoods? And my first thought is, businesses aren't open for business if they don't make money. So if they go there and they open up and people continue to come and support them, they're going to stay. And if enough people keep coming, more and more will open up. And it's not a great thing. And we know there's problems associated with some of that stuff, but I don't know what the policies are and what the city council and how the county actually handles or even ABC in the state of California handles the distribution and spread of permits within certain census tracts or neighborhoods or what have you. But I think that needs to be addressed at a policy level, and I mean the community groups and the nonprofit organizations who are working on these initiatives obviously need to address that with the policymakers in the communities, but the community needs to get involved as well. Yes, there's on the behavioral health side, the substance use disorder side, and everything. We're here addressing it and we're trying to bring in prevention and early intervention methods, but for some reason it's there, and for some reason it continues to get utilized, and the businesses stay in business or they wouldn't be there.
Yeah, and add to that, Dave, that the research that I have at my fingertips shows that when you the more liquor stores you add, the more consumption you create within the neighborhood. So it's not just that the more affluent neighborhood residents that want liquor are going in and purchasing at liquor stores in their neighborhood, but also the residents themselves are drinking more and more because it's more readily available. So it's not a true supply and demand curve like you hear in classic economics. There is this,
right.
The more you have, the more supply you have, the more demand you have.
Right, and many a grocery store, no matter what neighborhood you're in, they usually do sell different types of alcohol, and I do understand in certain parts of San Diego there are limits on selling the individual single cans of beer and so forth, and the smaller bottles or something. They're multi-packaged. They expand it so that it's not a cheap drink that you can go out behind the liquor store and drink, on a moment's notice. So because of course cost is one factor, and people who run around with $1.50 in their pocket, they may not be able to afford the $4 to get the 3-pack of the 24-ounce or 40-ounce cans or whatever they are. And then there's of course time elements where I understand we have liquor stores can't open and sell their alcohol. The standard convenience stores that are selling with the walk-in coolers, you just grab it and go. And I believe there's time elements where those aren't available until I think it's 9 or 10 o'clock or 8 o'clock in the morning, depending on the area. And I don't know all the particulars on that, which is obviously there to
conditional use permit too.
Right, exactly.
Yeah. Excellent. We're a little past time, but Bill, give you the final comment, and then we'll go back to Dr. Finn.
Thank you. And Dr. Finn, thank you. I wish you were cloned and we had a copy of you here in San Diego to work on this full time. And, to talk to this, add to what David Lee was just saying, and Craig as well, in those disadvantaged communities, I present about alcohol and we talk about substance use disorders, and the industry won't call them addicts or have a substance use disorder, but they refer to them as their heavy users. And that's 20% of their customers, but they're buying 80% of the product. So from a business standpoint, it makes sense if they are only profit driven and don't have any morals or ethics or care about the community. That is where the prime location is set up, a location to profit off of other people's social economic disadvantage and stuff there. So I really hope, this has been really eye-opening with the deeds and the documents and the government involvement and stuff going so far back and stuff. So thank you for opening my eyes to this, and we'll keep fighting here in San Diego.
Yeah, well, thank you. Oh, go ahead, Craig, sorry.
I was going to say, and the only other thing to add to that really quick was just the simple fact that as you add more liquor stores into an already stressed area, think about the average childhood experiences, the toxic stress in the environment. I mean, it makes sense why, liquor stores become more and more popular as you add create a more and more toxic environment too. So it's just another thing to keep in our minds that it's not a classic supply and demand curve that you hear in economics. There's some other factors that are generating demand, and the liquor stores are facilitating part of that. Dr. Finn, back to you.
No, I'll just close. I know we're out of time. I hope to see many of you next week. I'm putting in the chat my email address. You're welcome to hit me up directly anytime. I'm happy to share my slides. I'll share them with Craig so he can pass them around. But it's so lovely to be able to chat with you all. I'm so embedded on the East Coast. It's refreshing to hear West Coast perspectives, and it was lovely to meet a lot of you in person last week. So thank you very much, and I'm looking forward to next week.
We're glad to have you here, Dr. Finn. So look forward to seeing everybody a week from today at the same time. So thank you all for being here, and look forward to seeing you next week.
Excellent. See you, everybody.